Well, good afternoon. We pushed back an hour to give the governor a chance to make her announcement, which I completely support. We have got to extend the shelter-in-place order, and again, the governor's leadership has been outstanding from beginning to end. I want to start again with a piece of sad news. We lost Detroit Fire Captain Franklin Williams to COVID-19 yesterday, a 31-year veteran of the department. He was known for getting to his shift early, staying late to make sure every one of the men and women working under him had all their needs taken care of. And on top of working, he was a huge part of the community. He was a coach in the PAL Leagues, and he's survived by his wife and 7 children. But Captain Williams meant a great deal to this department, and he's going to be terribly missed. He was one of 25 individuals we lost from our community yesterday. And we are a resilient city, but this has been hard to bear. If there is good news again, it is in the trend lines in the city of Detroit. 25 deaths yesterday is terrible, but if you put it in context of where we've been, we lost 38 on Sunday, 29 deaths on Monday, 25 Tuesday, 26 Wednesday, 25 yesterday. As I've continued to talk about, the curve is starting to flatten. It's still going up, and we're going to see numbers of deaths higher than this, particularly with what we see happening in our nursing homes if we don't address it. We're a long way from this being over, but the efforts that the community is making is dramatic. And when you look at 38 deaths on Sunday, if we were still doubling every 4 days, we would have had 76 deaths today instead of 26. That's how much it matters that you wear your masks, that you engage in the social distancing. And to me, you can see all these models, all these predictions, they can all be confusing. I have one that I'm looking at that in my mind will judge how well this administration does and how this community does. And that is watch the TCF Center. So we're going to open 25 beds tomorrow, and in talking to the hospital CEOs, and this was my business, I understand the trends in hospitals. We're going to have to put ultimately in the coming weeks 200 to 250 patients at the TCF Center, just based on the crowding in the hospitals today. Those first 200 or 250 beds at the TCF Center are going to be needed. They built 1,000, and that was the smart thing to do. The governor did the right thing in building 1,000. But if we as a community continue to treat this the way we have in the last few weeks, I think it's possible we're not going to need those 1,000 beds. And I truly think the single best report card on how well we're doing on our social distancing is going to be how many of those beds we end up using, and I'm going to watch with interest in the coming weeks, as I know everybody is. But if we do in fact bend the curve, you'll see it in a very physical way. Assistant Chief James White has done a great job. Chief Craig is chomping at the bit to get back in the office, and as soon as the doctors release him and confirm to all of us that he's no longer infectious, he's going to be welcome back. But Assistant Chief White has done a great job. The commanders and I will have another, precinct commanders and I will have another conference call with Assistant Chief White and Chief Craig tomorrow. They have recommended to me so far that we do not need to order the closing of the parks because the compliance by members of this city have been so positive. And I guess I'm never going to be able to get past the fact that 4 people drive in a car in Dearborn, and it goes viral on social media, and it makes it look like people throughout southeastern Michigan aren't honoring this. I'll tell you, I was in the grocery store this morning. Every single person had a mask on. We're seeing the riders in the buses wearing their masks. We're seeing people in the parks space out. And to the 98 or 99% of the residents of the city of Detroit, I want to say thank you. And Assistant Chief White is going to talk about what he has done for the small percentage of people who continue to cluster. The neighbors are calling on them, and the cops are showing up in a hurry. And working together, we're going to beat this thing. So with that, I'll turn it over to Assistant Chief White.
Thank you, Mayor. So, as I always do, I want to start off by thanking the men and women of the Detroit Police Department who have been working tirelessly throughout this pandemic and commitment at a level that they've always had, but I could not be prouder of the men and women of the Detroit Police Department. I also want to thank the community. We put out the call last week to our community to be our eyes and ears, and they certainly have been our eyes and ears, and they continue to communicate with us when we do have those pockets of people who are not adhering to the governor's ordinance. To that end, we've taken some enforcement action that we talked about as recent as last week. We've continued to ramp up our enforcement efforts. The good news is that we're not seeing a need as we had initially to have the enforcement efforts in some areas. We're seeing that some people are in fact complying at a higher level. But with that still, we have had 952 checks yesterday for complaints that have come in, some things that we found while monitoring our virtual patrol through our real-time crime center and through some complaints that have come in from the community. We issued 261 warnings, 56 citations. We broke up 35 groups, 8 parties, and 1 business that we closed, and that was a beauty and barber supply company where the owner was warned once, and we found it necessary to take some enforcement action and close that business down. He was engaging in some particularly irresponsible conduct, opening his business and having a large number of people inside his business making purchases. Again, we continue to thank our community for their partnership. As the mayor indicated, because of that, we found that we've had good compliance with the parks. So we are not making the request at this time to close the parks. We hope that we'll be able to continue to keep the parks open for our community and families that are engaging in social distancing and certainly wearing the appropriate masks to go for a walk, that type of thing. But we don't want any parties, barbecues, and certainly no basketball games or anything like that breaking out. As we continue to work together, this shared sacrifice, we're confident that if we all engage in this shared sacrifice, that we have a good opportunity to get past this unprecedented time and get to a point where we can enjoy a beautiful summer in the city of Detroit. So we're just asking that our community continue to partner with us, notify your precinct when you have these groups that are out there that are in violation of the governor's ordinance, and let us know so that we can break it up so we can get past this epidemic. We're also very happy to report that we have over 400 officers that have returned to work. We've used the rapid testing. It's going very, very well. We're encouraged that we're going to get a large number of officers back routinely. The officers are raring to come back to work, eager to get back to work. I get a call or a text message every day from officers around the department that are happy to get back to work. So we're excited about that. And finally, we just continue to ask for your prayers for our officers, your support, and certainly your prayers for the officers the command officer that we lost. Certainly the fire captain that was lost. We just ask for your prayers and your support and continued support. So with that, I turn it back over to the mayor. Thank you.
So the Detroit police wrote 56 $1,000 tickets yesterday. And by now, I think everybody in this town has to know that if you start to cluster, one of your neighbors is going to call and that patrol car is going to show up. And the police are going to get less and less tolerant of doing this over and over and are going to respond with a higher percentage of tickets. We don't want to be writing you a $1,000 ticket. Please don't make your neighbors call on you, because they will call and the police will show up promptly. But let's all watch out for each other. Now that we have had several hundred police, fire, and DDOT employees return to work with the 15-minute testing, which has completely changed the ability of this city to respond to this crisis, we're now moving on to the next most critical issue, and we started yesterday, and that is our most vulnerable citizens in our nursing homes and in our homeless shelters. We have lost 11 people to COVID-19 in nursing homes, and we have had 141 other infections. It has now become the center of the battle in the city of Detroit. And Denise Fair has sent her team back out to more nursing homes today. We are going to start taking 50% of all the 15-minute test kits and use them for nursing home and homeless shelter residents. So we're going to use half to get our workers and the prison guards and the county sheriff's deputies back to work, but we've gotten through enough of that now we have to protect the folks who can't protect themselves. And so we are going to start testing 160 residents each day at nursing homes starting this weekend. We've already started with a number of them, and here's what we're going to do. The fire department, Commissioner Eric Jones, has committed a team of EMTs, and Director Fair and her medical director are identifying in order the nursing homes with the highest degrees of infection. We're going to go through and test everybody, because as we now know, a whole lot of folks who aren't showing symptoms actually have the disease. And up until now, we have not had the tools at the nursing home to effectively separate the truly infected from the non-infected. And so we will be out 1 to 2 nursing homes a day, 1 to 2 homeless shelters a day, and our EMTs will go through during the day. They'll swab the folks in the nursing homes and in the homeless shelters. And then after 7 o'clock at night, when the testing lab is shut down to our patients, the medical students at Wayne State will basically pull an all-nighter, and they will take the samples from the nursing homes, from the homeless shelters, and they will run them through the night. So the next morning, the nursing homes and the shelters can take the kind of decisive action we need. But we are going to address the spread. Arthur Jemison, the head of our housing and revitalization team, has been doing a phenomenal job. For weeks now, he's had his nurses out twice a week at every warming center, at every homeless shelter in the city. They've been identifying people that have been sick. They've been separating them. And we have identified so far 13 homeless individuals who are positive for COVID-19. And Director Jemison has made sure they're getting treatment. We don't yet have a case of a reported death of anyone in the homeless shelter, and we're going to act now and try to make sure that we can keep it that way. But to talk about the remarkable effort that a whole range of communities in this city, a whole range of agencies have pulled together behind to respond to our homeless population in this crisis is Mr. Jemison.
Thanks, Mayor, and good afternoon. The mayor was very kind in his words. I want to make sure that the team members who are out there right now, Donald Rencher, our HRD director, Tara, and the Homelessness Solutions team, as well as the embedded team members, Dr. Asabici and Dr. Rahman and David Bowser, who are working with them in the field with an array of great agencies like Detroit Rescue Mission Ministries, like NSO, the Salvation Army in particular, and Cass Community, who are out there in particular serving the most needy right now. Listen, homeless individuals are often very medically vulnerable, and they're around a lot of other medically vulnerable people. They're in buses, they're in stores, we've done some contact tracing. They are talking to and seeing almost 100 people a day in some cases. So it's really important that if we protect them and keep them healthy, we have a chance, as the mayor said, to reduce the spread. So since about mid-March, with the help of the health department, and frankly the help of United Way, Wayne State University, the Community Foundation of Southeast Michigan, we've had nurses going every Monday, Wednesday, and Friday to every single shelter, completing wellness and temperature checks, and sending anyone about whom the medical professionals are concerned being symptomatic, sent them to a facility we've got where they can have a door to close and a bathroom of their own until they can be tested. Thanks to Wayne State and Dr. Levy and others, starting last week, we began to be able to give them tests. Now we have the ability to have tests done much more quickly and in a way that allows us to more rapidly provide isolation facilities for people who are COVID-19 positive. Just a few data points to mention. We've got 33 people currently in our quarantine facility, 26 men and 7 women. Of those, as the mayor said, 13 have tested positive, and we've got 18 tests pending and 2 people who are going to be tested on Good Friday tomorrow. So I'm sure that data hopefully helps everybody, but I think it's as much an illustration to talk about what the nurses are seeing when they are going into facilities. We had a woman who was recently discharged from the quarantine facility as being negative, COVID negative. Unfortunately, we're working to get her placed right now, but she went out and brought toiletry kits and other PPE that she had to the facility later because of the kind of care that was offered to her, knowing that there will be other people who needed it. We've had the nurses talk about the reflections of homeless individuals who've said, we're so comforted to know that there's nurses that are seeing us every other day. It gives us comfort that the facility we're in is good and we've got an immediate connection to get to medical care if we need it. The mayor wouldn't talk about it, but the minute we had a chance to identify a place to expand shelter, he left the building again and to make sure that it was an appropriate place for homeless individuals to be. So I see this community coming together. When I'm out at these facilities, until Monday I'd been at a different place just about every day since the outbreak. The people from HRD and Health are out there every day making sure that this is working, and these tests just add another method for us to deliver services to people who are vulnerable, because by protecting them, we're protecting all of us. So with that, I guess I'd pass it back to you, Mayor.
Thank you for you and the team that have done such a great job on this. I was really pleased that the governor today established a task force on the racial disparities that are being exposed in this country by COVID-19. And there can be no greater step we can take than to make sure that people can get tested regardless of your income, regardless whether you have a doctor, regardless whether you have insurance, regardless whether you have a ride. We have to make testing available to everybody, because all of your decisions on whether you need medical care or whether you are healthy start with a test. And the way it started out in this state was a very limited number of people who could get access to those tests. What has happened at the fairgrounds has been remarkable, and Monday we will be taking 1,000 people a day through that facility. And I think by now this city knows, if you don't have a doctor, go to DetroitMI.gov. We got 30 physicians' offices that will take you, most of them, even if you don't have insurance, even if you don't have money. If you don't have a car and you don't have a ride, we will get you a ride, and it's been terrific to see the checker cabs pulling up into the center and making sure people are being transported properly and safely and getting their tests. But we don't need 1,000 tests a day. We need 2,000 tests a day. We're going to keep building. And I have been really focused on making sure every single Detroiter who needs a test can get one. And Congresswoman Brenda Lawrence has been saying over and over, what can I do for the residents who otherwise don't have access to health care. What can I do to help on COVID-19? And I said, Congresswoman, the single biggest thing we need is to expand that testing facility at the fairgrounds. And she said, let me go to work on that. Now, normally, you go to work in a divided Washington and nothing gets done. But I was just enormously pleased when the Congresswoman had a tremendously successful effort that's going to help us significantly by landing us a major international corporate sponsor. And with that, I just want to say thank you to Congresswoman Lawrence for being such a fighter, and turn it over to you for this announcement.
Thank you, Mayor. It is such an unprecedented time for us here in America, and it requires all hands on deck. It requires every person, every human being to bring to the table resources and support. And so I was pleased when I received a phone call, because I had been texting the mayor saying, you know, what can we do? And he said, we need resources, we need resources. So from my network of relationships, the vice president of Hyundai Motor, Hyundai, gave me a call and said, you know, Congresswoman, we were looking at the hot points, hot spots in the country, and we know Detroit is one. We have a good relationship with you, and we want to make an offer to you, to the city of Detroit, for $100,000 and 10,000 test kits. And I said, absolutely. I immediately texted the mayor and said, we have someone who want to make an offer. Who do I connect them to so we can make this happen? On my way here, I made the phone call, and it was verified that the check is being cut and the resources are being shipped, and so everything should be in place by Tuesday. But let me tell you, sitting here today as an African American, my heart broken because so many people that you see their names on TV, I had relationships with, I have memories. I know their brilliance that's no longer present in the Black community. The African American community is being hit and destroyed by this disease. When we talk about the police chief and we talk about the homeless, the Black community must step up more than anyone else, because we are being attacked on an unprecedented level. We are only 18% of Michigan, but 40% of the deaths, 39% of those who are infected with this disease. And why I was so passionate about and so excited to be able to call the mayor and to see instant response to this opportunity for resources is the fact that when we opened up, the mayor's vision and the team put together the test site in the state fairgrounds where it's accessible, where we're getting transportation for you to get there, the test to make sure that we can identify those who are infected and stop the spread. For every member of the African American community, when we say wash your hands, we mean it. We need you to do it. Put your mask on, we mean it. No gatherings. And I know it's hard sometimes. It's funerals, it's individuals' birthdays, and we will celebrate after this. We will come together after this, but we must do everything we can to not lose another life. And I'm saying this as an African American person and as a member of Congress representing the 14th District. I need everyone, regardless of your race, gender, economic situation, please take this serious. And, you know, to be able to see an international company that does have a president in Michigan to say that we are going to give our part to the city of Detroit to fight this pandemic. And I want to say, too, it takes a team to make this happen, and that team includes everyone watching this message. It takes a mayor, it takes a police department, it takes our department heads, it takes our churches, it takes everyone, all hands on deck. And I will continue to fight and get resources, and I tell everyone, please be safe. Be safe because our community needs you. We need the brilliance, and we will get through this, and I will see you in person, I know again, in a few months. God bless you. Be safe.
Thank you, Congresswoman, and thank you to Hyundai Motors. The Congresswoman and I had a chance to talk to the CEO, Mr. Jose Munoz, earlier today, and his Vice President, Zafar Brooks, who was so critical to putting this together. 10,000 kits, $100,000 to expand the testing. This is the way this community has come together. The last order of business, as always, is Health Director Denise Fair to talk about our latest numbers and what we can look for going forward. Denise?
Thank you, Mayor Duggan. So as of today, there are 6,083 confirmed COVID cases in Detroit and 272 confirmed cases. Now, this is 249 more cases and 25 more deaths than I reported yesterday. And I do send condolences to those residents and the loss of their loved ones. Now, we know that communities of color are disproportionately impacted by COVID-19. I applaud the governor for putting together this Michigan coronavirus task force on racial disparities to address this very concern. In a city like Detroit, whose demographics are predominantly African American, this is the right thing to do. And again, I applaud the governor for this bold and compassionate effort. Now, the governor has also extended her stay at home, stay safe executive order, and I am also in agreement with this order. Too many people are being sick and too many people are dying, so we do need to stay home. It's what we must do if we want to continue to help slow the spread of COVID-19. Doing so protects ourselves and our loved ones. Now, the role of the Detroit Health Department is to provide communication, education, surveillance, and emergency preparedness. Our role also includes looking out for vulnerable communities, especially during these times. That's why we're focusing our efforts on our seniors with a strategy for those living in nursing homes, as well as those who are homeless across the city. To date, we are now aware of 19 nursing homes who have reported confirmed cases. We at the Health Department are continuing to monitor these nursing homes by providing recommendations around testing, isolation, and environmental guidance to further diminish the spread and protect these populations. Yesterday, we launched our nursing home strategy in partnership with the city first responders, including fire and EMS, where they will now conduct on-site testing at these institutions. We're also working to provide similar attention and care to those in our community who are homeless. The testing will be conducted at these sites in partnership with Henry Ford clinicians and Wayne State University. That's why I am so grateful to Congresswoman Brenda Lawrence and Hyundai for their additional testing and funding that will help us to continue fighting this undetectable enemy. So while we are at home, I ask that we continue sending well wishes to our emergency responders, those service workers, and those who are working away from their families, living in a shelter, nursing facilities, or any other communal setting, or even living alone. So let's check up on each other, make a phone call or a text, just to check up on each other and make sure that we're all okay. I want to thank Detroiters for doing their part. I know you are listening, and together we're going to help flatten this curve. Let's continue to keep our distance, disinfect surfaces, wash our hands, covering our mouths and nose with a scarf or a homemade mask when we are out in public. And please don't be afraid to reach out for help. You may call the National Disaster Distress Hotline to reach out for additional support. Their number is 1-800-985-5990. Again, let's do this together so that we may gather together again with our loved ones and our friends in the near future. And so with that, I'll turn it back over to you.
So I want to just comment on the statistics that Director Fair just gave you. If those who are following closely, we only had 249 new infected cases in the city of Detroit, and we've been reporting 500 a day. I'm going to keep saying this, and like I said, the media has done a really good job understanding this. The reason we only had 249 yesterday was because there was a backlog in processing tests at the lab. Has nothing to do with the infection going down. And so they're backed up about 400 lab tests. They'll get caught up and it'll bounce back. Nobody should look at today's number and say Detroit's infections were down to 249, it's dropping. They are not. I will keep saying to you, if you're looking at the infection rate, all you are looking at is a report card on the lab capacity. It has absolutely nothing to do with the spread of the virus in this community. And now the city of Detroit is conducting almost a third of all the tests being done in the state. So when our lab gets behind on a day, it changes the numbers, but they will come back. This virus is still growing. It's growing more slowly than it was a week or so ago, but it's a long way from over. And I said this yesterday, every country that starts to let up when it starts to slow sees a spike immediately. And so I wish I had recorded Congresswoman Lawrence's speech, but I hope it's taken to heart by everyone in this community. And with that, we'll take any questions.
Mayor, regarding the governor's task force, Eli Newman from WDET wants to know how we plan to work with the task force and if we have any particular recommendations and what they should look at.
We will be partners on the task force, and I spent 9 years of my career at the Detroit Medical Center fighting racial disparities in healthcare. I got a whole lot of recommendations, but I will save those for the task force.
Okay. Regarding the nursing homes, do we know what the total population is roughly at the city's nursing homes, all 27?
I'm not sure. Do you have that number?
I don't have that number, but there are 28 nursing homes in the city, and that's just nursing homes. That doesn't include long-term care facilities or any other, but we can get that information and report back.
Okay, and last question I've got for now is regarding the number of tests for the Abbott 15-minute tests. We gotten 5,000 initially. Are we expecting to get more, and if so, do we know when and how many?
No, they're sending us 1,200 a week, and they just sent us their third shipment. So we are basically running 200, 250 tests a day, and they've been a godsend to us, and they keep coming in. And when Abbott raises their production, they promise to raise the number of kits. But right now, at 1,200 a week, we're running that machine 16 hours a day. It's going well right now.
Okay, that was the last question.
All right, thank you all very much.
怎么又晚了？
这诊所太远了，这里多开几间就好了。
政府里需要有我们的人，需求才会被听到。
哎，你这……哎，你们两个都对，可光说有什么用呢？填好2020年的人口普查，就可以协助公共资金的分配，比如地方医疗、更多的政府席位。想要给自己发声啊，赶紧上网填，打电话也行。
请上2020census.gov 完成普查。